Good morning. I'm Marty Jolly, Director of Nursing from Dakota Abilities. Today I'm going to talk to you about catheter care for the people you might be supporting. There are typically two types of catheters that you're going to see when working at Dakota Abilities. The first is a standard urethral catheter, and the second is a suprapubic catheter. So let me go ahead and show you what the difference would be between those. With your standard urethral catheter, the catheter is being inserted into the female's urethra or the male's urethra at the tip of the penis. If the person has a suprapubic catheter, what's happened is the physician has created an insertion site through the front of the abdomen that goes all the way into the bladder. And then a tube is inserted through there that allows urine to drain out of the bladder and into a bag. So those are the two types of tubes that you're likely to see here and provide care for at Dakota Abilities. Let's go ahead and talk about how do we empty the bag of someone who has a catheter? Catheter bags should always be placed below the person's bladder. So in this situation for Jim, his bladder is up here. I need to make sure that my drainage bag is below that. So I've got my bag hanging down here. What I can do is, if we get up into a different chair or if he gets up into a wheelchair, I can hang that underneath the chair to make sure that it's below the bladder. Okay, so the bag should always be below the bladder. It's draining via gravity, so it has to be lower in order for gravity to work and the urine to flow down into the bag. The first step is going to be to clean our hands. So if I have a sink, I'm going to use warm water and soap and wash my hands. I don't have a sink right now, so I'm going to go ahead and use my hand sanitizer. I'm going to get a dollop of this in my hand, and then I'm going to rub it together vigorously until it's all rubbed in and my hands are completely dry. Once it's all rubbed in very well into my skin, I'm going to go ahead and put my gloves on. Jim, I'm going to empty your catheter bag for you. I'm getting my supplies ready to do that now. Once I've got my gloves on and the catheter bag, the first thing that I can do is open my alcohol swab. So I'm just going to tear the container apart, and I've got my alcohol swab ready to go. Then on the bag, I'm going to squeeze these two side prongs, and that's going to release the drainage port from the bag. So I've got that released, but at this point, my clamp is still clamped. That's going to ensure that urine doesn't run out of the bag before I'm ready. Now I've got it ready to go. I can hold the bag over my graduated cylinder, and I'm going to go ahead with the flip of my thumb in a forward motion, release that, and the urine is going to come out and into the bag. Perfect example of why you always want to make sure you're over your graduated cylinder or over the toilet before you release the clamp. So once I've got all the urine drained out of the bag and into the container, then I'm going to go ahead and seal the clamp again. In order to seal the clamp when I'm done, I'm just going to press in tightly with my thumb. That's going to seal it. And now I'm going to take that alcohol swab that I got ready, and I'm going to be vigorously cleansing around the tip of this to clean off any bacteria that are trying to climb into that tube so they can get into the body. I want to prevent infection. So this is rubbing alcohol in an alcohol swab. It's the rubbing action for a good 10 seconds that's actually going to clean the bacteria off of the end of this. And then once I'm done cleaning that for a full 10 seconds and rubbing it vigorously all over that site, now I've already got it clamped. Now I can go ahead and squeeze those pincers on the side, and it's going to lock into that holding port. Now the bag is emptied, and I can go ahead and place that back into position below the bladder on the side of the bed. It's also really important to know, don't place the bag on the floor. Bacteria are always trying to find their way into the body. And so if they can climb onto the bag, they'll find their way into the body. So we want to make sure that bag is always hanging from the hanger that comes with the bag. We've drained the catheter bag into our urine collection container. The next thing I want to do is double check the amount of urine that drained out into the container. For that, I want to set that on a flat surface and check the amount that was in the container. I might need to write that down or put that in that person's MAR later. Once I'm done and I've documented how much urine came out, if we do have to track output, this can merely be dumped into the toilet and flushed away. Now I'm going to go ahead and provide catheter care to Jim. Jim, I'm going to go ahead and provide catheter care right now. I've got myself warm, soapy water, and I've placed a washcloth into the container with the warm, soapy water, and then I've got myself a dry towel to dry when I'm done. I only want to reveal the area that I'm going to be cleansing during this process so that I can keep Jim as warm as possible throughout. All right, Jim, I'm going to go ahead and pull the blanket down and do this. So I'm going to pull the blanket down, and I'm just showing the area that I need for this care. First thing I'm going to do is clean the anatomy of the person, that person's body. So for Jim, I'm going to clean his penis from the tip and then down, pulling the bacteria away from the opening at the tip of the penis. Next, I'll go ahead and clean the catheter. I'm going to go ahead and take my warm soapy washcloth, and I'm going to be cleansing around the tip of the penis first, and I'm just going to be wiping all the way around, and then I'm cleansing down and away from there. So down and away. I never want to be pulling bacteria or the washcloth up toward the opening at the tip of the penis, always pulling down and away from the opening. Once I've got that area cleansed, I'm going to put the washcloth back in the warm soapy water, get it sudsed up again. Next, I'm going to hold where the catheter inserts into the body. I'm going to hold that catheter at that point, okay? That way, while I'm cleansing the tubing, while I'm pulling on that tubing in that process, I'm not actually pulling on the catheter where it's going into the body, okay? So I'm not going to cause discomfort for the person because I'm holding the catheter into place here with my fingertips. Warm sudsy washcloth, and I'm just going to wrap it right around that catheter and gently pull it down the tube to the end of the catheter. And that's it for catheter care. My washcloth can go back in here. I've got my dry towel. I can pat dry around the penis, and I can dry along the tubing, and then I can get the person dressed. All right, Jim, we're all done. Go ahead and get him covered up, and we're good to go. The next level of support you're able to provide for a person with a catheter, and you don't have to be med certified to provide this level of support, is you can change a person's catheter bag. Sometimes we'll have to do that if the person switches from a catheter bag. Maybe they use a smaller bag during the day that's strapped to their leg, and then they use a larger bag at night. By not having to drain that bag throughout every 2 hours throughout the night, it's going to allow that person to rest comfortably throughout their night. The first thing that we want to do when changing a person's catheter bag is hand hygiene, okay? So we're going to wash our hands if we have a sink and soap available. I don't have a sink right now, so I'm going to go ahead and use my hand sanitizer. I'm going to get myself a generous pump of hand sanitizer. I'm going to rub it vigorously all around my hands, and I want to keep doing that until all of the hand sanitizer has dried. Once my hands are dry, I'm going to go ahead and place my gloves. All right, Jim, I'm going to go ahead and switch you out from your night bag to your day bag. I've got my gloves on. I've got my supplies here. I'm going to go ahead and uncover the area that I need to see while I'm doing this process. Okay? So I'm pulling it back, and I'm going to need access to where the catheter itself connects to the tubing that goes to the drainage bag. Once I've got this here, I want to make sure that I'm not pulling on the catheter itself because that's going to put pressure on where the catheter sits inside the body, and that can cause irritation to the tissue. First thing I can do with my fingers is I can clamp this tube between these two fingers, my thumb and my index finger, and then I'm going to merely be doing kind of a twisting. So the twisting is going to happen with my other hand. I'll be twisting and slowly backing away. Now I've got the two separated. Now this, I'm not going to be using right now, so I can go ahead and set that aside. What I want to do here is I want to cleanse this tip with an alcohol swab because bacteria are always trying to get in to that person's drainage tube, and we want to cleanse this site to get bacteria off the area. So I'm going to go ahead and just take my alcohol swab. Reminder, it's rubbing alcohol, so it's vigorous rubbing and friction that's actually going to be removing the bacteria. So I'm going to do the scrub for a full 10 seconds, applying that friction so that I get the area clean and any bacteria that were sitting on the outside away from it. And please note, I've still got my tubing kinked here. That way, if any urine is building up, it's not going to come out of the tube while I'm in this process. Now I can go ahead and grab the day bag that the person is going to use while they're up during the day. This bag simply attaches to their leg. I'm just going to connect at the site that I've just cleaned. There we go. And now I would be able to attach that to the individual's leg. There also, most of the time, is going to be a short little tubing that will go between the catheter and the bag. And so in that situation, you would attach that tubing to the bag and then place the other end of that tubing into the catheter, just like we did with this bag here. And then if the person has the leg strap, we're going to want to attach that to the leg to keep it from pulling as the bag fills with urine. So that's how you'd switch them. Now we've got the other bag that we're going to want to use again tonight. So I need to go ahead and clean this. So I can go ahead and cleanse the end with an alcohol swab for 10 seconds using that vigorous motion. So just cleansing the tip, getting any bacteria off of the end of that tip. The next thing that I'm going to do is I'm going to drain my bag. My bag is empty because we just went through the process of draining it. So I would drain the bag. Once the bag is drained, I'm going to go ahead and put a solution that's a mixture of 1 part vinegar to 3 parts water. So if I'm using 1 tablespoon vinegar, then 3 tablespoons of water. I just mix that together in my container. I bring that into the room with me. Then all I have to do is pull that up in my syringe. And the syringe tip is going to fit right into the tubing, and I'm just going to flush that into the bag. Once I've got it flushed into the bag and I've placed the amount in there that I need to, then I'm going to let that sit for 20 minutes. And after 20 minutes, I'm going to go ahead and drain the bag, and then the bag will just hang on a hook until we're ready to use it again. Another thing to take note of when you're dealing with a person with a catheter is if at any point it looks like they're not draining urine into the bag, you want to check along that tubing as it's traveling up toward the insertion point in the body, and you're looking for any potential kinks, because those kinks can cause it to not drain. So if it gets kinked and it's under that person's body, you're going to get that tubing out from under that person's body, unkink it, and then you want to watch to make sure that it starts to drain. If you come back 15 minutes later and it hasn't started draining anything yet and you've checked it and there are no other kinks, then you're going to go ahead and give the nurse a call. We might need to actually flush that catheter, or we may have to replace it altogether. Thank you so much for your time.